Welcome back as we close out our exploration of the respiratory system by learning just a few nerves related to the respiratory system. The first one is the phrenic nerve. So the phrenic nerve comes off that cervical plexus in the neck and it travels in the anterior neck. If you want to know where in the anterior neck, look at the left picture. The phrenic nerve is highlighted here in yellow and it sits right on top of this muscle, which is just anterior to the brachial plexus. So it sits just on the surface of the anterior scalene muscle. So if you go back and look at the pictures of the scalene muscle from before, or look at the model pictures, then you can clearly see the phrenic nerve sitting on top of it. From there, it enters the chest cavity and it goes between the lungs and the heart on both sides, travels through the mediastinum inferiorly and innervates the diaphragm. So this is the muscle that innervates the diaphragm. So the diaphragm will contract, lower down, and you will inhale. The second set of nerves are branches of spinal nerves, and they travel in the costal grooves on the undersurface of the ribs, and so they're called intercostal nerves. They travel just adjacent to the intercostal artery and the intercostal vein, all of them just on the undersurface of a rib. Continuing on, the most important nerve, the vagus nerve. This is the most important of all cranial nerves, the 10th cranial nerve. When it exits the skull, it travels in a groove between the internal jugular vein and the common carotid artery. In fact, all three of them are sheathed in a little bit of areolar connective tissue. From the neck, it then enters the chest cavity. And it continues medial to the phrenic nerve. So the picture on the right has both the phrenic nerve location and then it shows the vagus nerve. So the vagus nerve hugs the blood vessels a lot more. And there's a really good reason for this, and that is because the vagus nerve is going to give off a branch known, which on both sides, whoops, you can see it on both sides in this picture, but on the left is where you clearly can see it on certain models, and it's very easy to see in real life. And this branch on the left goes under the arch of the aorta, and then it will travel back in a superior direction right next to the trachea to innervate the larynx and the area surrounding the thyroid gland. So yes, there is a right recurrent laryngeal nerve as well, but it does not go underneath the arch of the aorta. It just goes inferiorly and then comes up the right side. And so this is a layout that happens in all mammals. Like for instance, in a giraffe, that vagus nerve travels all the way down the 8 feet of the giraffe's neck, or 6 feet, or however tall that giraffe is, down into the thoracic cage, and then the left recurrent laryngeal goes underneath the arch of the aorta and then travels all the way back up. Okay. And with that, we are done with our exploration of the nerves, and we're totally done with learning about the respiratory system. So thank you for working hard on this section, and I will see you as we explore our next topic.